Thank you for inviting me and the American Lung Association to participate in today's session. In the next few minutes, I will summarize some of the efforts by the American Lung Association to improve the uptake of low-dose lung cancer screening in the at-risk population. Many of these programs are ongoing, but highlighted during last month's lung cancer awareness campaign. Although lung cancer remains the leading cause of cancer deaths among Americans, there has been a 33% increase in the lung cancer survival rate over the past 10 years. This is largely due to the exciting advances in targeted and immunotherapies. In fact, over 40 new lung cancer treatments have been approved by the United States Food and Drug Administration since 2016. We predict this trend will only increase as we begin to see data reflecting the lives saved by lung cancer screening. In the next few slides, I'd like to review our approach to increasing lung cancer screening, our new lung health barometer findings, and also some key findings from our 4th annual State of Lung Cancer Report, which explores the lung cancer burden at the national and state levels. One of the strategic imperatives of the American Lung Association is to defeat lung cancer. As seen on this slide, this is a multi-pronged approach that involves educating and raising awareness, advocating for access to screening and lung cancer therapies, and funding research to close gaps in knowledge and help develop interventions to prevent cancer or its progression. Last month was Lung Cancer Awareness Month, and here's an overview of activities that we highlighted during the month. We kicked off with our lung health barometer, that I will speak to in a minute, and then throughout the month we shared Lung Force hero stories, in which patients or their caregivers and loved ones shared stories of their journey from the first moments of facing their diagnosis through their treatment experience. We have found that stories like this empower other patients and help them utilize tools they need to interact with their family and their treating physicians. It can also act as an impetus to those who qualify for but have failed to seek screening. Also during this month, we released one of our signature reports, The State of Lung Cancer. Our Saved by the Scan campaign is a multi-year awareness-raising effort in conjunction with the Ad Council. This campaign directs individuals to a website where a simple quiz determines if they are eligible for low-dose CT scan screening if they meet the United States Preventive Services Task Force criteria. That criteria has recently changed with a drop in age to 50 years old and pack year requirements down to 20 pack years, which will greatly increase the number of eligible individuals, especially among individuals of color. On this slide, you see the improvements in the metric that we monitor since the campaign's inception, especially the over 600,000 individuals who took the quiz and then hopefully went on to discuss and obtain a low-dose CT scan with their healthcare provider. This year, we also introduced the 2021 Lung Health Barometer, a new nationally representative survey conducted by the American Lung Association that examined the awareness, attitudes, and beliefs of 4,000 Americans about lung health and lung cancer. As shown on this slide, 29% of Americans know that lung cancer is the leading cancer killer of men and women, and this is an 8% increase in awareness over 2020. Also noted on this slide is the need for more work to be done, since only 36% of respondents knew that lung cancer screening was now available for early detection in at-risk population. Another multi-year project that is being updated due to new United States Preventive Services Task Force recommendations is the jointly developed American Lung Association and American Thoracic Society Implementation Guide for Lung Cancer Screening. This is meant to be a pragmatic guide and toolkit of how to design, implement, and conduct a lung cancer screening program that was based on a survey of experts in lung cancer screening. The hope is that information on this website will help hospitals and healthcare systems learn what they need to do to establish their own screening programs. The more programs available across the country, the more readily available scans will be to those at risk and eligible. We know the burden of lung cancer is large. It's the leading cancer killer of both men and women. But we also know, based on the data we have analyzed, that the burden is not the same in every state in our country. The data in this report will provide insight into how each state is doing on some important measures of burden, and hopefully provide a roadmap for the work to be done to decrease the burden both in each state and nationwide. These are the categories that our report focuses on, and I want to share just a few of the findings. For example, the 5-year survival rate is now 23.7%, as reported in our 2021 State of Lung Cancer report. This represents a dramatic 14% improvement over the past 5 years. The nationwide burden of lung cancer is large, but we also know it's not the same everywhere. This report finds that there's more that each state can do to turn the tide against this terrible disease and save lives. Based on the National Lung Screening Trial data released almost a decade ago, we know that annual low-dose CT scans among those at high risk can reduce the lung cancer death rate by up to 20%. Unfortunately, nationally, only 5.7% of those at risk were screened in 2020. A key finding from this year's report is that after consistently increasing every year, the lung cancer screening rate among those at high risk did not change from 2019 to 2020. We feel this is likely due to COVID-19 lockdowns, limiting access to healthcare resources, and the public's reticence to enter medical facilities during the pandemic. The results in this category in this slide, the stage of diagnosis, highlight the need for improving lung cancer screening so that the shift to lower stages at diagnosis can improve mortality. This year's report shows that nationally, only 24% of cases are diagnosed at an early stage, when the 5-year survival rate is much higher at about 60%, and the disease is much more likely to be curable. Unfortunately, about 46% of cases are not caught until a late stage, when the survival rate is only about 6%. The early diagnosis rate has increased 36% over the last 5 years. And we noted that it was highest in Massachusetts at 30% and lowest for Hawaii at 19%. I would also like to highlight just a few of the metrics that deal with disparities. Nationally, the 5-year survival rate is highest for Asian Americans and Pacific Islanders, and 11 to 17% lower for people of color. In each of the categories reviewed, disparities are called out. Here we see that nationally, early diagnosis rates were highest for white Americans and 14 to 16% lower for people of color. I hope this has given a brief overview of some of the projects the American Lung Association is undertaking in our efforts to defeat lung cancer. Much more details on our State of Lung Cancer report and our efforts to increase lung cancer screening can be found at our website, lung.org, which is available in both English and Spanish. Thank you, and I look forward to further discussion and answering your questions.